I heard from one of the presenters that triage is being practiced for COVID victims who have other medical conditions. We know Governor Cuomo, in the early stages of the pandemic, ordered ambulances coming from senior homes not to come to the hospitals, but to return the seniors to the homes. These sorts of things are crimes. In China, for example, one patient who was 103 years old, who had dementia and other conditions, was not ignored. 4 military specialists were brought in. They even found serum to treat him, and he was cured. Shame on us if we make excuses for triage. So that was the comment. And again, as I said, you can decide to take it up or not, but I think it's important for me just to say here, and this is because it was a character of several questions we're not asking. It's clear that people are very concerned that the work of the committee and the work to establish this public health extension service really go ahead, because there's a sense that even if vaccines have been produced or other things have been done, that the situation is really not being addressed because the cofactors and the policy factors are not being addressed. So I guess, why don't we do it this way? I'll start with you, Dr. Evers-Manley, because you had brought it up, and we'll sort of go to everyone. And again, you can elect to answer it or not, but I'd like for people to sort of make summary remarks at this point.
So I'll just simply just refer everyone to look at the waiver 1135. It's a Medicare waiver that gives hospitals the opportunity to have several different policies and procedures that they can don't have to live up to because of their being a Medicare provider during a crisis or during an epidemic or during a state of emergency. So when former President Trump called the emergency, there were several hospitals that received waivers, which is 1135 waiver, so they won't be penalized to provide certain levels of care. Some of the hospitals were and did elect to use a protocol in regards to do not resuscitate for certain individuals. So we have to look at that, and I'm not saying it was necessarily the wrong thing to do at that time. If they didn't have the means to provide those services, they didn't have enough ventilators, they didn't have enough equipment, they didn't have enough PPE, because you were going to hurt the medical providers. But again, that creates a level of mistrust in the community. And so again, if we're having those policies and procedures and waivers, we should also simultaneously educate the public of what's actually happening so that they can talk to their loved ones who may be ill and going into the hospital and make a decision about do not resuscitate or what may happen to them in a crisis that we have. But you can look it up. You can look and see which hospitals actually implemented 1135 waivers. And one of the things that must happen during that is that the waiver only lasts a certain period of time, and then you have to go back and renew the waivers. And we just want to make sure that those waivers were carried out appropriately across the country. But it's 1135 waiver from CMS to be able, since we're in a state of emergency.
Okay. Well,
yes, that's a very, very key point. I know I had among my staff, one of my nurses and her husband both had COVID. The husband had already been put on the ventilator when I was told about it. We were able to get the nurse in. She lived, the husband died. There has been a disproportionate number of African Americans, in fact, more Black males die. I do hope you can share my slides, Dennis. That's the kind of data we need more of. Disaggregated data has not been as available as we need. And I think the point that it's a very critical point that is being made. I'm going to defer to Dr. Lang for some other issues, but this is where we need to now, I think the fact that we have a health equity office now, and as Dr. Cameron Webb says, that gives the administration more muscle to really look into these kind of matters. But the data is so important here. But I think here's where Dr. Elders' issue of having community health workers. The patients and families need to know about advanced directives. They need to know that if you have a loved one in the ICU, there has to be an advanced directive. These kind of questions would be answered. So just the education of how do you best protect your family member when they go into a critical situation like that. So we need the data, but I think it's a point of real concern for us in the African-American community. And I think this disparity in terms of vaccine availability to the African-American population is just another point to raise our concerns. But again, I'll defer to Dr. Lang for other comments.
Well, thank you, Dr. Faget. I would just say that I 100% agree with everything that Dr. Evers Manley said. I saw it repeatedly firsthand in the hospital, how 1135 waivers have been exercised and executed in our hospitals here in Los Angeles, California. And I had patients who were very healthy, who had what's called an acute renal failure, meaning that it's a temporary new thing. It's not somebody whose kidneys failed them 20 years ago and they've just been barely getting along, but their kidneys were working fine. And then they got hit with COVID, and as a part of the cascade of medical events that takes place in that type of situation, their kidneys shut down. And under the 1135 waiver, hospital was able to say, we will not give this patient dialysis because we don't have to under the current circumstances. Unfortunately, that patient expired because under that waiver, this previously healthy man was not able to be given the adequate full resources because the hospital didn't have to do it, and they didn't have to transfer him to someone else. They said, we don't have the resources to give him dialysis, so we don't have to, and we won't. I had a patient with COVID who was on a ventilator. We got him off the ventilator. The family was essentially told that the patient would expire when they extubated him. The patient lived when they took him off. And he got into a situation about 2 weeks later where he needed to get ventilatory support again. And the specialist in the intensive care unit said, no, he's too weak, he's too sick. We won't put him back on the ventilator. So this is a point that I brought up at a town hall meeting back in April of last year with some legislative representatives, that it's very important that we have our legislators put things into place, guidelines, policies, and procedures on how these types of decisions are made, who makes these decisions, whose voice gets listened to, because it's unfair to families if there's no procedure in place and it becomes an individual decision. Things may not go the way they should. And one thing that I've seen a big problem with is, I would call it bias. I would call it bias because a lot of people affected by COVID are elderly, and a lot of elderly people nowadays may have some dementia, but there's a bias during a crisis such as this one, where people are feeling like any dementia whatsoever is a reason not to use limited resources, and that this patient is less deserving of full opportunities to recover than someone else who has a mind that is fully functional, quote unquote. But we've seen people whose minds are fully functional that have a less statistical chance of surviving, but their mind is very good. And you've got people who may have what you could call a touch of dementia, someone who's living at home with their family, talking, eating, gardening. They may repeat things, forget 5 minutes later that they told you something. To those families, that loved one's life is just as precious and should be given a fair chance. So I think it's important for us to realize that policies and procedures need to be put into place when triaging of that nature is going to take place to protect everybody. It's unfortunate that this condition has gotten to a point in our country where we're being forced to rationalize medicine. But if we're in that position, I think it's really important that we have laws in place as well as policies that dictate what will be done, how will it be done, what conditions will be prioritized for treatment, so that there is fairness and equity in the treatment and allocation of the resources available. I think we've got to make sure that happens, because if people are biased against a patient for any reason, some physicians might say, oh, I see in the chart that this patient used amphetamines. Oh, they're a drug addict. We don't need to use resources for a druggie. And, that's a medical condition, and it's a medical condition that is treatable and curable. And there are a lot of people walking around today that have had a history of being addicted to medications and have gotten treatment and gotten over that and are very productive citizens of the country, throughout the world. And I don't think those types of decisions should be made unilaterally, but the reality is they go into the hands and the power of the person that's making that medical decision. So I think that's important. On an somewhat unrelated issue to that, I just think that everything we've said today goes hand in hand with the importance of us trying to see how we can make an impact, whether it's in one small village, one small province, and demonstrate for the world to see what can be done, how we can help when we come together and work together with our resources to make one place a better place. And hopefully others, like I said, will be inspired and motivated by that to do the same thing elsewhere. Because so many times people think if they don't have full control of a situation, that there's nothing that can be done. But I think it's important for all of us to realize that there's plenty that we can all do, and it doesn't necessarily have to be something where you have full control. Where there's a will, there's a way, and together we can make this work.
Okay.
And I thank you for the opportunity to speak and be a
Yes.
part of your panelists.
Yes. Yes, you're very, very welcome. Marcia?
Well, personally add just to what Dr. Lang said. We feel a tension if we can only muster a small shipment, for example, to Africa. You can call it a pilot, an initiative, a project, an initiative, or whatever. So our minds know that it still matters, as Dr. Lang said, to some village, some location. But our heart wants it to be bigger. We want to solve these things. But yet this can make all the difference in the way it can catalyze, inspire, or affect the right kind of action we should have. And that gets back to this terrible situation about this waiver or rationing care bias that we have had described now in our health system in the US. And in the food system, what did we see in the last couple years? That last year, when we knew that, say, the big, huge meatpacking plants had workers that were very close together, that were very exposed, the virus came, and instead of us providing more emergency help to the limited infrastructure, send in the Marines, space out the conditions on the kill lines, do anything you had to. Instead, there was the order given that the packing plant should stay open as is. Dozens and dozens of meatpacking workers died. Inspectors died from the agriculture department. Even then, there had to be closures because it was so hideous, and millions of animals backed up with nowhere to go. Mike Callicrate's already described. We shouldn't have these situations. We shouldn't have our doctors and nurses and healthcare and home care workers put in this circumstance, or our food care workers, or that gets back to how we need to fight for the emergency economic change, a new financial system, getting rid of the speculative-based monetarist system and this corporatist cartel system, so we won't have to make these face these situations that we've had of bias and the death rate that shouldn't be. So I think that's all I say. I see this initiative of the committee to do these pilot projects, like everything from the community health and ward aid in Washington, or to the initiative to Africa, as part of this system of making this fundamental change internationally.
Okay, Mike?
Wow, that's some heartbreaking discussion around the healthcare problem. And again, I just think we have a concentration issue, a monopoly power problem, for-profit corporate decision-making that results in a lot of those sort of decisions. And I just hope that we're going to be able to develop policy that allows communities to rebuild, localizes economies, and restores faith in ourselves to govern from that local, more local level for healthier communities. And I would hope that we in the future can relieve the for-profit global corporations, Wall Street, hedge funds, and Bill Gates from making the critical decisions that affect our land use, our food, and our health care. And I really appreciate being on the call today. I've learned a lot, and it's great to think we can come together and come up with something far better than what we have. Thank you.
Thank you. Thank you very much. Bob?
Yeah, well, I'd like to just say I think the masses are looking for leadership, and I think the leaders are looking for a way to break out of this control mechanism, like Mike says, that's created a narrative around the monopolies and this cartelization process that's international. And the idea of getting back to, the family farm and all the science involved in actual food production, but also the communities and the way the social life used to be to develop the culture and that kind of thing. But, it also brings to mind the things that these cartels are now pushing. For instance, this global reset is huge in agriculture. And what we see is in many different ways, they're going to really try to sink their claws into more control through the advances of the electronics. And that doesn't mean we shouldn't use electronics. We should have a million more young family farmers all using the highest states of technology and getting paid for food production. But the cartels are going to be using and are using it in the areas of real estate. They're out there. Monsanto developed and bought a company that's got a whole program. They're soliciting going to retired farmers. 60% of the U.S. farmland will exchange hands and change over in the next 20 years. And they're going to the retired farmers and they're saying, Mr. Farmer, I know this is a tough thing. You don't understand the computer system. You don't understand all the different types of renters that are out there. We'll help you out. Pay us a fee and we'll help you out. We're seeing the same kind of thing coming from Bayer Crop Science, the big cartel that bought Monsanto. They've got a program. They're going to the farmers and saying, look, you need some help with your records? We've got the most sophisticated thing on the market. And with 5G coming on board, there's going to be much more sophisticated ways to nail down information. But they're setting in place programs to marry their technology into the individual farmers that are left. We see a whole green policy, meaning to set up through the World Wildlife Fund and their promotion of the Global Roundtable for Sustainable Beef, processes like that in many different areas where they will create the kinds of criteria where a meat packer can say, well, look, you don't meet the formula that we require, that the World Wildlife Fund set up, which is getting back to the financial world of Prince Philip and Charles and the oligarchy. And we've even got companies now that are making agriculture loans, and they determine the interest rate, lower the interest rate, if it actually produces less food. And one company is called Replant Capital. It's owned by Dannon Dairy Company out of France, which is one of the biggest in the world. And I just read today that the CEO of that company just got removed because some of the shareholders didn't like the way they were promoting this policy. So that, I mentioned that in terms of things that we need to share with more and more people, so they got a much bigger understanding of the magnitude of what this cartelization is doing, in order so that we can unite and pull people together to put forward a policy for millions of new family farms and food producers, and take that concept and knowledge to the world.
Okay, thank you very much. Now I see that Dr. Elders is back. I understand that there are some people making a documentary about you, and that is why you had stepped away. Well, I know I wasn't supposed to say it, but I decided to say it anyway. I think you may be muted, so check.
I'm unmuted now.
Okay, yes, you are. So we're just taking any summary remarks at this point, or any observations you'd like to give us.
Yeah, but yeah, I really have. I felt that this has been a very excellent conference, and it's covered several areas and several things. And to talk about, obviously, if you're hungry, there is no way in the world that and don't have adequate nutrition. There's no way to be healthy. So we can talk about all the good doctrine, and we can talk about having community health workers and the best. We can have the best scientists, the best everything in the world, but if you don't take care of nutrition, and well then there's no way that you can keep people healthy. And I think that more and more and more we have been made to think about and talk about the social determinants of health. We've also got to talk about some of the social determinants of health, as well as all of the other factors that go to make up health. Now we're beginning to look at the mental aspects of health. We've got to also look at all the other things that are going on that goes to make up a healthy world. And we can train young people from the beginning, and we've got to change some of our attitudes about. That's a part of some of the problems that we are having, and it starts early, and we can make a difference. And I think that's what we've heard some of today. I really have enjoyed and felt it was very good. It's what we heard from the farmers. Having grown up, many of us certainly grew up on a farm. I said worked from sun up to sundown, and I spent my whole life trying to get out of the cotton patch. Was very pleased to make it out of the cotton patch. I think I've done some things that have made a difference, but I still feel that there's a lot of things that you can learn on the farm, a lot of things about working together, helping one another, helping other people, helping the community. When I look and think of what this COVID virus has taught us, I think that most of us came in with many and different kinds of ideas and unusual things that we were thinking about, but I think COVID has exposed our weak underbelly and has really given us and made us aware of that we need 20/20 vision. We've got to have everybody, the whole world involved. We can't get rid of this virus alone. No country can get rid of this virus alone. No city or state. We're all involved. We've got to all work to make sure that we reach this important designation. And I think that this conference has helped us open some of our eyes to really see that there are many people involved. We've all got something to offer, and we all need to make sure we get out and offer whatever it is that we have to offer, whether we're old, whether we're young, regardless to our educational status. Everybody has something to offer. Just mentioning our churches, let's help in the distribution of vaccines. It's certainly in many of our rural areas, even in many of our low-income city areas. Some of the big churches have gotten involved. And so I think that this has made us think about that. We've all got to be involved. Our whole nations and other nations all over this world got to be involved. And the only way we're going to beat this vaccine is to make sure that it's eradicated from everybody. Thank you. I've enjoyed being a part of this conference.
Well, Dr. Elders, once again, you have demonstrated, despite the erroneous opinion of some, that you are a true leader among men. We thank you. And now we're going to ask Helga to say a few things. Oh, one other thing I wanted to say was that in an earlier incarnation, I would have said to you, figuratively, at least, we are still trying to get this entire country out of the cotton patch.
Well,
yeah,
we
all right. So we're at the end of our session and the end of our conference. And so, Helga, we'd like to hear what you've got to say to us all and what we should be doing.
Well, I mean, I was really reminded very, in a certain shocking way when you, Dr. Lang, were talking about these waivers and the triage, because, this is something which is not by accident. I mean, if you look at what we published in the last 30, 40 years, before the Schiller Institute, I had initiated the so-called Club of Life, which was to counter the idea that there are limits to growth and that, that there is such a thing as non-worthy life, which, you have these health economists who have written books which say that in the last half year of somebody's life, the medical costs are the highest. So therefore, if you can reduce these costs, the medical costs for the whole population goes down. So these waivers and these so-called holes in the system, which become acute when you have a pandemic, that is not an accident. This has been going on for a very, very long time. And, today in the other panel about Southwest Asia, this came up because of the absolute negligence in terms of what happens to the people in Yemen. There are 20 million people in Yemen who are food insecure. 400,000 children are immediately threatened with death. Dr. Beasley was in Yemen, and he said that he saw children dying in front of his eyes, and he couldn't do anything about it because there was no material there. He could not do anything. That their skin looked like pergament, so thin, and there were only a few kilos left, like a third of the size of their age. Now this is known, this is not, it's not a secret. And there is such an indifference, and that has a method. So what came up in this discussion was a reminder of the Nuremberg tribunal, where Dr. Leo Alexander, who was the main medical advisor to the judges, and he said that the way how euthanasia started was with a only very slight change, a slight shift in the way how people respected the sacredness of life. And that once you started, even in the slightest, to say that there is such a thing as unworthy life, because somebody is sick or somebody has dementia or is a drug addict, that you start to go on the slippery slope, which ended up exactly where the Nazis ended up. And I think that that is going on right now. I mean, sure, you can say there has to be triage because there are not enough ICU units and not enough beds and so on. But why do you think they are closing down hospitals in the middle of the pandemic? Because that's going on in Germany right now. Which does not make sense at all. So I think that one can, and that's what I tried to say before, one cannot take what is happening in each field, like the medical field or the farm field, out of the context of that the world is run right now by Wall Street, by the City of London, by Silicon Valley, and that these people could not care less about human life. They are in only for their profit and the consolidation of their power. So, obviously, you have to take all of these factors into account, which should not discourage us. I think the work of this committee is very valuable. And, the only reason why one can have hope that we will get out of this crisis is because there are good people like you. All of you who spoke, are the kind of humanity which needs to be protected. And it's only with good people like you that there is any hope to get mankind out of this crisis. So I feel very much encouraged by what you have been saying. And I would like to, make this work a little bit more, let's say, outcome oriented. For example, what Mike Kellicourt said, about the local commerce. I think what we need to do is we need to produce a video where you, Mike, basically develop this concept, maybe together with Marsha and Bob, why the cartels are doing what they're doing and why this is the death of the farm sector. Because I know that there are many, the reason why the German farmers go in the streets with their tractors, and they get no support from the media. They go with tractor lines of 500 tractors all the way to Berlin. They occupy the capital of Germany for a whole week, and they keep doing it because they know they're fighting for their existence. And once you destroy food, no food, no farmers, no food, no people, so it's an existential fight. So let's make a video where you together with Marsha and Bob, produce a video which I think will be extremely attractive for many people who are fighting the same issue. The same, I think, on the question of community health education for young people, because if you look at just the 4 panels we had at this conference, we have people in Latin America who are absolutely concerned about young people. And for whatever reason, I feel embarrassed to say that, but the people in Latin America right now are in a much more revolutionary spirit than the people of Europe. And it's much easier to mobilize people than even in the United States, where people are more in the trend, not really mobilized in the way they should be. So the Schiller Institute has international connections. You saw in the panel about Southwest Asia, that we have people on a minister level, people on the level of very important institutions who all want to learn, like this idea of tele-education. What Hussein was saying, that he is teaching economics via the internet. I think we can professionalize this teaching much more. And, I think that the discussion today, gave me a whole bunch of new ideas of how that can be really made more effective. So I think that we are coming out of this conference with incredible, on the one side, richness of knowledge about what are the problems, but it's good because, where do you find a platform where you can look at the problems in the totality, because that is really what is needed, because the oligarchy likes us to think in terms of segments, in terms of compartmentalization, and that way, we are manipulable. But once you start to take a different view, you can also, communicate this knowledge in a better way. So I want to thank all of you, and really, I think we have a very powerful message to go out with.
All right, so Bob Baker, Dr. Waldorf Faggett, Dr. Shirley Evers Manley, Dr. Khadija Lang, all these doctors. Mike Callicrate, he's not a doctor. Marcia Baker, Doctor and Surgeon General Joycelyn Elders, General Joycelyn Elders, and 5-star General Helga Zepp-LaRouche. I want to thank you all for being with us today. And I want to invite everybody that heard this panel, and there are many people who are asking what they can do, just get in touch with the Schiller Institute. We have work to do, and you just heard about part of it. And so on behalf of the Schiller Institute and all the people that participated in the conference, we want to thank all of you for being involved, both today and for what you're about to be involved in the future. Good afternoon and good evening.